Welcome to Sport and Spinal Weekly, brought to you by Chiropractic Sport and Spinal Rehab. Listen each week for health and wellness programs and ideas, chiropractic information, and helpful tips for a healthier lifestyle. Plus, weekly guests from around the area. It's time for Sport and Spinal Weekly with Dr. Lyle Erickson and the team at Chiropractic Sport and Spinal Rehab.
Sport and Spinal Weekly, here we are on another beautiful day here in March. Certainly has been nice. And with that, I suppose Dr. Levike is with us. Good morning.
Good morning.
But I suppose people get a little antsy to get outside, don't they, Doc?
Yeah, well, I think we all feel it, huh?
Well,
it's been a
cabin
wonderful,
fever,
yeah,
right?
Wonderful winter, but yeah, I mean, when it's 50 degrees, 55 degrees, up to 60.
And pretty much unless you do work out and have some exercise program, then it probably won't be a shocker to you. But what I was going to reference to, but when we go outside and do stuff, that's generally where we find a little extra physical activity required if we're going to move something or rake, right? Do some twisting and bending, and then and I'm alluding to what we're going to talk about this afternoon. I've done it myself, and then my back is a little stiff, and it's my lower back.
Yeah, lower back's really common complaint amongst people, and of course, if you've been, inactive or less active in the winter, and then get out and do stuff. It's nice out, and yeah.
Is it common for that kind of to be sore? I'm not saying hurt, but just stiff or sore?
The soreness, the stiffness, of course, depending on, you're using muscles you haven't used in a while. Yeah, any muscle will probably behave the same. Low back is a weight-bearing area. I mean, a lot of weight on there. Lumbar vertebrae, the pelvis area, the gluteal area. They're large muscles. I mean, They make you. That's the one. Those are the muscles that make you walk, carry your weight, most of it. So I mean, the really important muscles down there that they'll overwork. You'll feel them.
And I'm not to say that I'm sure some people have serious back injuries. It's their lower back, but that excluded. Just the common person, and even though a person getting a little older in age, maybe it's not so much that we're getting older, it's that we're not as active. Maybe not as much exercise?
Yeah, definitely. And then that's one part. And then the other part is probably never really addressed
an issue?
The issue and to start with.
Well, we'll talk about that coming up. We'll also talk with Paul and Rita from Living Touch Massage coming up here also this afternoon. It's another week of Sport and Spinal Weekly on 92.1 The River.
You're listening to Sport and Spinal Weekly on 92.1 The River.
Preventing work injuries in the workplace is especially important in this economy when employers need to reduce costs related to work injuries. Chiropractic Sport and Spinal Rehab in Bemidji offers complimentary back safety talks to local businesses with options of complete training and certification, which could potentially reduce workers' compensation claims and insurance costs for employers. If you or your workplace is interested in back safety, please call Chiropractic Sport and Spinal Rehab in Bemidji to schedule your back safety talk today.
Your recovery from injury is so important to you and your family. If you or someone you love is in need of physical or occupational therapy, request Choice Therapy of Bemidji. You do have the right to choose where you receive therapy services. Choice Therapy will work closely with your physician, giving every patient the highest quality care possible. Choice Therapy also offers free 15-minute injury consultations to see if therapy will help you return to top form. Your life, your health, your choice. Choice Therapy of Bemidji.
Hi, I'm Erica at Chiropractic Sport and Spinal Rehab. I assist the doctors with patient care, exams, therapy, and x-rays. Call us to find out how we can help get you out of pain today.
All right, we are back. Dr. Levike with us. Chiropractic Sport and Spinal Weekly here, and we're talking lower back. And I suppose a lot of people, is it also a common thing that maybe we, even if you don't have back problems, but like you throw it out or you just, because you lift something wrong? I mean, most people probably experience it.
Well, there's two causes. Well, there's several causes of low back pain. I mean, there's different types. There's acute low back pain, which is, after trauma or accident or lifting wrong. That's acute, meaning it just happened. I mean, this is like fresh injury related, usually.
Okay.
And then the other type is more of a chronic. Chronic low back pain is you've had it for, greater than 4 or 5 months, and it just kind of reoccurs once every 3-4 months, a couple times a year. You get the low back pain, and it's like, you got to take a week or 3 or 4 days to not do too much. You know yourself, and sometimes it gets worse as years go, and they get more episodes and they get more severe. Definitely something you need to nip in the bud, I guess. When you first, low back pain is, pain that itself is a red flag.
Do people that are very physical have an activity program? Do they have low back pain as well, or
less often, of course? If you're more active and you got a routine and you're using these muscles regularly, and and then you're on a preventive plan or chiropractic care, preventative care, I do adjust, and I get adjusted every 2 weeks, and I got a lot of patients that get adjusted weekly to every 2 weeks to prevent any events of low back pain, and that is really, really an important part of being healthy. Is you make sure your mechanics are healthy.
Right. I've heard you guys say so many times that everything that has to be working in proper order.
Definitely. To work optimally. If you don't have to work optimally, you don't have to have your body work at the optimum level. If you don't want that, that's fine as well.
Mm-hmm.
But if you're going to use it and you're going to be depending on your body, if you do a physical work, if you want to, like I said, depend on your joints and muscles and to do what they got to do when you want them to do it, well, they got to be healthy. You got to take care of that. Prevention is for everything. I think if you want to keep the value of something and you're going to use it every day, you're going to have to do some prevention, some maintenance, some type of maintenance.
At the clinic, how much is lower back?
In general, I would say lower back pain is the most common complaint of all complaints that we see. Then maybe neck pain, headaches, mid back pain maybe third, and then you get the numbness and tingling and all the other symptoms.
Carpal tunnel and stuff that we talked about
But low
before.
back pain is extremely common.
And then sometimes as you guys do your work and you talk with your patient, then you discover it actually is leading from somewhere else. There's something else that's causing it.
Yeah, the cause is really important. Like I stated in previous talk shows, the diagnosis is really important to diagnose it properly. It could be a mix of degeneration, some little bit of wear and tear in the discs or the facet joints, and then we could determine that on an X-ray easily. With a good exam, we could determine if it's more muscle spasm or compensation, or maybe a bad posture, maybe a posture at home, maybe a sitting posture a chair that's not well ergonomically correct at work. Or
what about a bed?
Yeah, bed, same thing. I could, once I see you and once I poke and I do my exam and I do a couple of visits, I'll know what's going on.
Well, you and Dr. Erickson, you make me laugh because I always think you kind of have this idea. So I was hooking up the mic earlier, and so Dr. Levike was behind me, and he said, "So, lower back today," and isn't that what you said?
Lower back pain.
And I said, "You can tell?"
How did you know?
How did you know?
Well, Mark had a little bit of low back pain lately, and we kind of talked about it. It was kind of funny.
So it's a common thing. You guys see it a lot, and I'm sure. So my next question is a lot of the time is it your back? Is that part of your back is a better term, I'm sure that you can call it, but like your back's out of whack?
Well, there's different pain origins. From low back pain, I would say the most common is facet joint is the joints, the articulations of the back. Okay, there's two on each side. There's 5 lumbar vertebrae. So, and eight joints, and the lower 2, lower 4, L4, L5, and the sacrum more likely to be inflamed, and that's a very common pain generator. The joints in the back there. Another cause of low back pain doesn't have to do anything with the spine. Is on the outside between the sacrum and the ilium, which is the pelvis and there's a joint there on each side. If you push on your lower back on the right and the left, there's little dimples.
Yeah.
All right, those are the SI joints, the sacroiliac joints. Those really commonly as well cause back pain. If it's one-sided, if it's below the belt line and one of those little dimples, definitely you got a sacroiliac problem. Maybe sometimes radiating down about half the buttocks, maybe half the thigh, but probably will not pass that, will not cause any tingling or numbness. And then there's, of course, degenerative changes in low back pain. If you get a disc degeneration, then that could generate some pain, some inflammation, some muscle spasm secondary to that. So a lot of different causes. Nerve root compression is another one. If you got a nerve that's compressed or irritated, then you'll definitely feel some numbness, tingling down your lower extremity of your leg. And that's definitely a more serious problem.
So then coming into and seeing you or Dr. Erickson, if that was a situation, is there techniques or there are certain practices that you do that can help alleviate that pain, like almost immediately or not?
Well, definitely the goal is to remove the causative agent. If it's inflammation, we need to focus on inflammation, decrease the inflammation. If it's lack of mobility mixed with that, then of course we have to increase mobility into the joint as well as decrease inflammation. If it's muscle spasm that's causing your pain, we're going to have to decrease the muscle spasm. So there are definitely, and we use physical therapy modalities, chiropractic manipulation to the spine, stretching, ice, whatever we need to do. The first goal is to get you out of pain, get you back on track. Well, as soon as we can.
I know how many times I've just if I just lay on the couch for 2 days, and I know I'm not the only person that thinks this way.
Yeah.
That it'll kind of get better and I'll be able to deal with it from there on out. That's probably not a good method.
Well, the body has this innate intelligence or innate way to fix itself. Of course, if you cut your arm on superficially, you'll get a response right away. It's going to bleed, and then you're going to get some plasma cells and serum, and things are going to you get a patch there, a natural patch with a scar.
Okay.
And this in 3-4 weeks the scar is gone and you're healed. Now this happens inside as well. It's everywhere in the body.
All right.
So if you get an inflammatory process going on there and some muscle spasm and some pain, the body will try to fix that. Of course, with rest, it's going to speed things up. But if you come and see somebody that does this for a living, can help you, we're going to cut the treatment lapse.
But sometimes I can certainly tell there is something out of place down there, and there's nothing laying on the couch is going to fix.
Yeah, but instead of taking 3 or 4 weeks or a month to heal, then we could do it in a week or two.
So it does help.
Cut that in about half. Oh, definitely. And it needs to heal correctly. If you lay on the couch and let it heal, most likely this is not going to heal completely and not correctly.
And you'll revisit that problem again in the future.
Definitely.
It happens.
It'll reoccur.
Well, and that's what I'm saying. I know. I just spent a little time picking up stuff over the last, with the nice weather. I know it's good. So stretching, it sounds so easy, but how many people don't do it before they go out and do yard work or something like that?
And then the stretching, most people think of stretching their back or the posterior aspect, the glutes and the legs, and a lot of times it's a different muscles that we need to stretch. It's in front, and it's deep inside, right next to the spine. I mean, you've got a deer before, I'm sure, or you've seen. Do you know what the tenderloin, where it's located? Okay. Well, that muscle is extremely, extremely important for low back pain. If it's tight, it's a flexor muscle. So if it flexes your trunk if you're sitting, that muscle is definitely shortened.
Okay.
And if it's too short, too long, when you get up, you can't unfold, you can't sit straight, or you can't stand straight right away. And that muscle is really important because it's a flexor, and we're all flex all day. We're sitting, we're bending, we're stooping, we're gardening, we're raking. It's always that same position, and that is extremely common for low back pain. That muscle is involved.
Oh, so what's the remedy for that? Because I have that problem.
Stretching. It takes another person. It takes somebody that knows the stretch first of all.
So
and
I
it's
got to
stretch that's laying down, and I'm allowed to go through
I'll
it. But
have to make an appointment.
Well, it's it's called post-isometric stretching is the most effective stretching, and
because sometimes it feels like it's all locked up and it's just tight in there. There's nothing.